Hello and welcome. Today we'll be discussing radiation cataracts, a specific type of cataract caused by exposure to ionizing radiation. We'll delve into the causes, how it affects the eye, symptoms, diagnosis, treatment, and ways to prevent this condition. So, let's begin our journey into understanding radiation cataracts. Radiation cataracts are primarily caused by exposure to ionizing radiation. This exposure can stem from various sources. Medical treatments, particularly radiation therapy targeting the head, neck, or brain, are a significant cause. Occupational exposure, such as in nuclear power plants or during certain industrial processes involving radiation, also contributes. Less commonly, exposure from accidental nuclear events or even cosmic radiation during prolonged space travel can lead to the development of radiation cataracts. The severity and type of radiation, along with the total dose received, and the age of the individual at the time of exposure, all play crucial roles in determining the risk and onset of the cataract. The pathophysiology of radiation cataracts involves a complex interaction between radiation and the lens of the eye. Ionizing radiation directly damages the lens epithelial cells, which are responsible for producing new lens fibers throughout life. This damage disrupts the normal arrangement and structure of the lens fibers. The damaged cells migrate abnormally and accumulate in specific regions of the lens, leading to opacification. Radiation also induces oxidative stress within the lens, further damaging the proteins and lipids that maintain lens clarity. Over time, these changes lead to the formation of a cataract, obstructing light and impairing vision. The epidemiology of radiation cataracts is closely tied to the prevalence of radiation exposure. Individuals undergoing radiation therapy for head and neck cancers, or those working in radiation-prone environments, have a higher incidence. Children are generally considered more susceptible than adults due to the rapid proliferation of cells in the developing lens. Estimating the precise incidence is challenging due to the variable latency period between exposure and cataract development, which can range from months to years. However, studies consistently show a dose-dependent relationship, meaning higher radiation doses are associated with a greater risk and earlier onset of radiation cataracts. The signs and symptoms of radiation cataracts are similar to those of other types of cataracts. Common symptoms include blurry or cloudy vision, difficulty seeing at night, increased sensitivity to glare, and a perceived halo around lights. Colors may appear faded or less vibrant. There might also be frequent changes in eyeglass or contact lens prescription. It's important to note that these symptoms develop gradually over time, often years after the initial radiation exposure. The specific symptoms and their severity will depend on the location and density of the opacification within the lens. Diagnosis of radiation cataracts involves a comprehensive eye examination by an ophthalmologist. This includes assessing visual acuity, examining the lens using a slit lamp microscope to detect opacities, and potentially performing dilated eye exams to better visualize the entire lens structure. A thorough medical history is essential to identify any past radiation exposure, including radiation therapy or occupational hazards. While the appearance of the cataract may suggest radiation as a cause, it's crucial to rule out other potential factors, such as age-related changes, trauma, or underlying medical conditions. Radiation cataracts do not have distinct classifications in the same way that age-related cataracts are categorized. However, they are often described based on their location within the lens. Posterior subcapsular cataracts, which develop on the back surface of the lens, are particularly common following radiation exposure. Cortical cataracts, affecting the outer layer of the lens, and nuclear cataracts, developing in the central part of the lens, can also occur. The specific type and location influence the symptoms experienced by the individual. The primary treatment for radiation cataracts is surgical removal of the affected lens and replacement with an artificial intraocular lens, or IO. Phocoemulsification, a technique using ultrasound to break up the cataract before removal, is a common and effective surgical approach. The timing of surgery depends on the severity of the cataract and its impact on the patient's vision and quality of life. Post-operative care includes using eye drops to prevent infection and reduce inflammation. The visual outcome after surgery is generally excellent, restoring clear vision for most patients. Regular eye exams are essential following surgery to monitor for any complications. Prevention of radiation cataracts focuses on minimizing radiation exposure. During radiation therapy, using shielding devices to protect the eyes is crucial. Adjusting the radiation beam to avoid direct exposure to the lens is also important. For individuals working in radiation-prone environments, adherence to strict safety protocols, including the use of protective eyewear and monitoring radiation levels, is essential. Public education about the risks of radiation exposure and proper safety measures can also contribute to prevention. The prognosis for individuals with radiation cataracts following surgical treatment is generally very good. The vast majority experience significant improvement in vision after cataract removal and IOL implantation. While there is a small risk of post-operative complications, such as infection, inflammation, or retinal detachment, these are relatively uncommon and can often be managed effectively. Research continues to explore ways to further improve cataract surgery outcomes and to develop pharmacological agents that might prevent or delay cataract formation following radiation exposure. For instance, studies are investigating the potential role of antioxidants in protecting lens cells from radiation damage. Further research could bring more effective preventive strategies.